Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. Lynn Lebowitz is a master's level social worker, certified yoga instructor, and resilience coach. She is also certified as an associate certified coach through the International Coaching Federation and has recently focused study in both resilience and trauma-informed coaching. For 15 years, Lynn provided counseling to help individuals and families face challenges in their homes and relationships. She took a pause from counseling while raising her 3 children and decided to reemerge as a counselor and coach after navigating a major health challenge in 2017. She launched Life Navigation LLC in 2018, determined to help others to thrive during stressful times. Lynn, it's an honor to be here with you today. Thank you.
It's an honor to be invited. Thank you so much.
You have such a rich background with all of your experiences. I'd love to know what inspired you to become a counselor.
I became a master's level social worker pretty much right after my undergraduate studies in sociology. And I was pretty young at that time. I didn't quite know what I wanted to do, but I knew that I really wanted to be in a field that was a helping field. And sometimes it comes from a process of elimination. So I knew I was pretty bad in the field of sciences. And so I kind of ruled out any medical occupation. But I knew, and this wasn't a term back in 1988 or 1990, but I knew that one of my gifts was emotional intelligence. And I wanted to be able to help people who are struggling with emotional issues. And I really felt like I had that capacity.
It's interesting that you say back then maybe emotional intelligence or those qualities weren't spoken about because even coaching, right, 10, 15 years ago was not part of mainstream conversation.
It was
And
not.
yeah. So I'd love to know when you first enter the field and into getting your master's in social work and all the work you've done in terms of helping families, then taking that pause, focusing on your family. What inspired you, or how did you get introduced to coaching after all of that?
I also was not familiar with the world of coaching. And it wasn't until I was navigating my own healthcare crisis that I discovered the power of coaching. So in 2017, I went through a major health crisis and it really turned me upside down. And while I was able to recover from the physical aspect of that trauma, there were remnants from the emotional experience. And I really was seeking support for that. I really knew within myself that I wasn't who I knew myself to be. And I ended up connecting with a life coach. And she really offered me this very transformative, powerful experience. And through that experience, I felt really passionate about the coaching process.
So you had mentioned that you hadn't heard about coaching until you had gone through your own major health challenge. And how did it support you? Obviously, as you were seeking medical treatment, what did coaching do to help either support the healing process, or I don't want to, put words in and say fill in the gaps because I'm a little biased and I know coaching fills in gaps.
Right, right. So I guess I had heard about coaching, but I didn't really understand it. And maybe I didn't value it at the time. But my personal experience, and I will emphasize that it's my personal experience and no one else's, is that I found that this individual had this capacity to really hold space for me to go through my own process at my own pace. And so I really connected with this idea that I was guiding this process. So, in addition to this person holding space for me and allowing me to have this strong emotional experience and even experience grief, which I know historically has been an area that's been defined for grief counselors only, I can tell you that this coach was really gifted at helping me move through a grieving process. But beyond that, it was really powerful because once I released all those really strong emotions, I was able to really take the time and have the space to imagine what I wanted my next chapter to look like. And that was really freeing. And it allowed me to create life navigation, which was so aligned with my values. And so that was the other piece of coaching that really resonated with me, was just how much we talked about vision and values versus pathology.
Hmm. It's interesting too because to have this foundation of social work and counseling to build off of, and then to transition into coaching, where coaching is an unregulated field. Often I've seen a lot of healthcare providers, myself included, that feel liberated by the transition because there's so much more we can focus on. And as you were talking about, your coach specifically supported you through grief as well, and just allowing the expression of those emotions. And so I'm I'm really curious because you are one of the rare few that have firsthand experience in both. How would
Mm,
you describe the difference between your work as a social worker and counseling versus coaching?
yes. So, when I first started in the field of counseling, I was part of a treatment team. I worked in an outpatient clinic in a psychiatric hospital. I was part of a treatment team. And what we did every time a new patient entered the building is we had a comprehensive psychiatric evaluation and we formulated a diagnosis. And so the model was very much a medical model of pathology. Whoever came through our door went out of the door with a diagnosis. And so that was very different from the world of coaching, which was to meet and greet a new client and to just see the whole person. And that is kind of what my orientation has been my entire life. I always wanted to work with someone around empowerment and wellness and growth. And so that was actually very congruent both in my counseling world and now in my coaching world.
Hmm. It's amazing too how just the different foundation and different settings, you had mentioned about coming in with a diagnosis, leaving with a diagnosis.
Mhm.
Obviously, mainstream medicine is the same way. And so, with coaching, when you have to see someone as whole, resourceful, having unconditional positive regard, it really changes everything where we're not just labeling somebody by a condition and we get to focus on who they are as a person.
Absolutely. And I
And
think the experience for that patient or that client is so much different when they feel that. Because people are smart and they know when you are aligning with them and when you see their power and their capability.
exactly. It's also interesting too when people go and learn coaching skills. It's not necessarily that you have to become a coach to use them. They integrate them into their personal lives, all their conversation. It just becomes a part of us. And so it's very interesting that you brought up how much this coach supported you as you were going through a health crisis and grief, because you could back up and be like, wait, what is the role of a coach? Wait, grief, don't you need to go to a grief counselor or someone within the scope of practice? And so it's really interesting that it sounds like there's room for everybody to support each other. And so I would love to hear from you further. How would you explain the scope of practice of a counselor versus a coach?
Mhm. I would love to have this conversation because historically I have experienced a lot of frustration around this conversation. In my core coaching class, there was a PowerPoint that was brought up every single module, the difference between coaching and therapy, and how they defined it and how it was described in this PowerPoint was therapy focuses on the past and pathology, and coaching focuses on future and growth. And that's how they distinguish between coaching and therapy. So I think there is some truth to that. However, I think it's a very narrow definition of the differences between coaching and counseling. And in fact, I think there are more similarities than there are differences. So there's just a ton of gray area.
Can you tell me more about that? Because our past is so much of who we are and shapes our perceptions of everything. And so, yes, I understand like there's certain things we do not provide medical advice, and we work in support of clients and their healthcare provider team. But when you talk about gray and just a little bit more of that gray line between past, present, future, and having time being the one thing that supposedly on a PowerPoint, because I know a lot of people have gone through that, that's
Yes.
supposed to break it up.
Mhm.
Maybe like the focus might be understanding the past gets more the present, but the past still comes into play quite a bit, right?
In my experience, the past does come into play. I think where we get into shaky ground as coaches is when we think about our role as excavation. We're not going into the past to excavate. We're going there simply to inform the present and the future. So I think it's like a real disservice to our clients to stay in the present and focus on the future. And then if someone brings up a painful moment from their past, to say, oh, no, stop, we can't go there. This is coaching, not therapy. I think that's a real disservice to a human being who comes with baggage, who comes with a past, or who comes with pain. We all have some level of pain. And if we can't acknowledge that to some degree, then how do we move forward? And how do we have this growth and transformation and all of the things that we offer as coaches? We need the whole package.
And learning how to deal with those moments when you're coaching somebody, working with someone, and they bring up something very personal, very sensitive. And
Mhm.
the one biggest thing, so I had the privilege of meeting Lynn, just for our listeners, in a trauma informed coach training. And trauma is not a contest, right? What is triggering or sensitive? There's no way to objectively decide what's traumatic and what's not for somebody, and it's not a contest. And so, as a coach, it's extremely important to have awareness of when these moments come and how to navigate them, right? How to manage ourselves, how to navigate what's coming for the client so we don't do what you said and be like, oh, I'm a coach, not a therapist. And we don't want to do a disservice. And at the same time, we don't want to cause harm either.
100%. So I think what I would add to that conversation, and you're 100% right, is that one of our calls to action as a coach is to hold space for clients and to ignore this reality that clients come to us with stress or anxiety or trauma, whether it's a small t trauma or a big T trauma. To ignore that reality is really a disservice to our clients, because our call to action is to hold space for our clients, to be present for them with whatever they're going through. So I think that that's where there's such a huge overlap between counseling and coaching. Just to be clear, what helps me to understand when to refer out and when to keep moving forward, my line in the sand is when there's functional impairment. So if a client comes to me with anxiety, okay, fine. Most people come to me with anxiety. That's not a reason to refer out. But an anxiety disorder is different. And why would I think that maybe it's an anxiety disorder? I might think it's an anxiety disorder if there's functional impairment, if this person is refusing to go to school or can't go to work or can't leave the house or isn't eating or sleeping in the way that they are used to eating or sleeping. So you have to ask those questions. And when you see that there is functional impairment, then that's like, oh, yeah, this is beyond my wheelhouse.
That's really great practical advice for anyone in this field of work, because then from there, once you realize, okay, that isn't in my scope of practice, I can support you in other ways. One of the ways that I like to ask them when that comes up, especially, it sounds like that's something that's really impacting you. Have you discussed this with your healthcare provider? Just opening the doors for that conversation to really create that space of exploration and also having clear expectations and agreements at the beginning of the coaching relationship.
Absolutely. I think establishing clear agreements up front and letting your client know what coaching is and what it isn't really helps set the stage for your relationship and for just creating expectations that are realistic.
Right. And like you said, so the anxiety is one example, functional impairment is one example. Any life threatening situations, obviously, knowing when is really, hey, I need some help here.
Absolutely. I like to think of it as there are many disorders, like psychiatric disorders, and coaches are not trained to treat a psychiatric disorder. So if someone is exhibiting obsessive compulsive signs or addiction issues or eating disorders or suicidal ideation. I mean, these are the bigger types of problems that require someone with a deeper, broader scope of experience to be able to intervene and provide intervention. So, coaching is not therapy, but coaching can be therapeutic.
Yes, yes, of course. Yeah, I know that's a very good saying about the therapeutic value of coaching without it being therapy.
Mhm, mhm,
It's also interesting too, because when you talk about the gray and the overlap, and
mhm.
so I know like for instance, when the American Psychological Association talks about counseling, they talk about how a counselor makes use of techniques such as active listening, guidance, advice, discussion, clarification, and coaches don't advise. But it's the same thing. And most professional fields have to make use of the active listening and discussion. And so it's very interesting because there's certain specific niches in coaching, right? There's a lot of gray and an overlap between them. So I'm curious if you could just explain where you've seen this come up with your, you know, because I know you have a great foundation in both counseling and coaching. Where do you see gray? Are there specific areas?
I absolutely do, and this is where I get a little fired up because I think about that PowerPoint and this future past growth pathology, and I think, "Wait a minute, there's just so much more gray." And what I wanna say too for therapists is there's so many therapists that focus on growth and future and empowerment, and so it's really not helpful to have that definition and to pigeonhole a therapist into like past and pathology because therapists do way more than that. But where I see a lot of like obvious overlap within coaching and therapy is, for instance, cognitive behavioral therapy. Cognitive behavior therapy is defined as a structured, short term therapeutic technique that aims to change a client's maladaptive cognitions and behaviors into more adaptive ones. And then in contrast to that, we have cognitive behavioral coaching, which is defined as a coaching technique that draws on principles from cognitive behavior therapy and rational emotive behavior therapy, which helps individuals enhance cognitive abilities and foster more effective behavior. So it's very nuanced. It's almost exactly the same, but some nuance there. And in both of those domains, we're challenging cognitive distortion. We're trying to get people to create a perspective that is more rational, that is clearer, that is more expansive. And both of those modalities are accessed in different ways, one by coach, one by therapist, but they have a lot of crossover.
I can see why something like this would fire anyone up because you're basically using one philosophy to define another.
Exactly, and then I was thinking about another overlap, and there's Gestalt therapy, which focuses on present moment awareness. So we've got that Gestalt therapy, which has been around for a long time, and then we think about mindfulness coaches. And mindfulness coaches really focus on present moment awareness and try to look and see, like, how are you feeling? What's going on in your body? How can you be here now? All of these things that we do in this realm of this mindful, aware world that we live in now. So there's just a ton of overlap.
Yeah, it's really interesting because it's It's almost like how do you label and put a box on human communication? And at the core of all of this is that there are ways to talk to people that evoke transformation, that evoke empowerment, that enhance self-awareness. And so whether it's, in a school, a teacher does these techniques, a lot, there's so much overlap regardless of where it is. So it's like the core of these things are very similar. But it's, I guess, what we had discussed earlier about kind of knowing really where your scope of practice is and where to draw the line.
Absolutely. I would just say one more thing because this is another area that really gets me fired up, and that's just anxiety in general. We live in a society, in a world where there is a lot of stress. And for people to say that they are not experiencing any level of anxiety, it's just not true. It's just not real. And so we have to welcome that and acknowledge it and acknowledge people's pain and suffering because that's all part of healing. And coaches can be in a position to help people find their pathway to healing.
Absolutely. And I know we had talked about just how important it is. Like you and I had gone through trauma awareness and trauma informed training. Even one step short of that, as we mentioned before, coaching is unregulated. And so it's so important to work with a certified coach or a credentialed coach who's credentialed through a major coach credentialing body, such as the International Coaching Federation or the National Board for Health and Wellness Coaching. Because with these, there are standards, there are ethical standards we have to abide by. And so, because, when you talk about anxiety, something that is a normal human experience in this day and age, sometimes coaches can be the first point of contact that a person might have into healthcare. And yes, our role is not the traditional role of a healthcare provider, but it's still extremely important to be aware of all of this because there is a shortage of healthcare providers and access is always an issue. And also, as coaching is unregulated, there's no state lines that you have to practice by versus therapy and medical professions there are. So, with all of that in mind, it's even more important for coaches to be as professional as possible, keep up with their credentialing so that way they can really do clients a point of service, right? If they are indeed the first point of contact into a healthcare system.
100%, Jessica. I was going to say the same thing. All coaches are not created equally. We come to the table with different backgrounds and different skills. And there's so many different domains in coaching. There's health and wellness, there's resilience coaching, there's trauma informed coaching. There's people who just put up a sign and say they're a coach. There's executive coaches, leadership coaches. So I think as a consumer, as a client, if you have a specific need that you come to the table with, it's really important for you to do your due diligence and to find out what the background is of your coach. What is the credentialing? How are they qualified to give you the help that you need? Because, like you said, it's not a regulated field. And so, as a client, you have to advocate and know what is going to align with what it is that you need.
Right. And another important part of that unregulated field is you're talking about, which is people advocating for ourselves and finding the right help, so to speak, in terms of someone who's credentialed, but also for just coaches and collaborating with therapists and collaborating with healthcare providers, doctors, nurses, any other healthcare provider as well. Because we're unregulated, there's this like at least amongst coaches sometimes you'll hear talks of like a turf war between the two, and but I've never personally experienced it. Usually because coaching is so much more well known now, we are part of a healthcare provider team. As long as we are staying within our scope of practice and supporting the client, it's all about the client, right? So whatever is best for them and help them move forward. Most therapists, most psychiatrists are like, yes, you're working with a coach too, that's great. But because of uh, the lack of regulation, it does become, even if I'm choosing who to work with and I'm a healthcare provider, like just to make sure that we do our due diligence as professionals, to make sure if a coach is coming to us to work with us, that they have the right credentials.
I agree with all of that, Jessica. It's because it's I think I don't know if it's a newer field, but it's certainly become a much more popular field. We are needing to be more integrated with healthcare providers. And I think part of that is that there's a huge demand for not only our services, but that of counselors. And counselors are burdened. Like they can't handle all that is coming in their way. So to have extra supports and extra resources to help support people in navigating life's challenges, it's a win-win for everyone.
Exactly. And that population you were talking about that therapists are seeking, it's such a high number. Is it like 1 in 5 people, or I know so many are untreated for mental health as well. So I know you probably know the numbers better than I do.
I read a statistic that 30% of Americans were struggling with either anxiety or depression. That's a huge number, and I would think that's even underreported.
Agree, that's probably underreported. And of those people, how many actually have access to care?
Right. Right. That's true.
So it's extremely important to raise
Mhm.
awareness of these issues. So grateful for contributing to this today, because this is something like you had mentioned. It doesn't matter if you're a health coach, an executive coach, a life coach. I feel like in every single coach training, that PowerPoint comes up, coaching versus therapy. And
Yes.
it's such, yes, it does.
And I think this conversation really creates more questions than answers. It just and coaching is about creating awareness. And I think that's what our conversation is about today is let's create more awareness around the gray area in this domain and not be so quick to decide that something is black and white when it really isn't.
Oh, exactly. It's so nice because the International Coaching Federation also provides a really nice resource for coaches. I will share this in the show notes. It's for free. It's written by ICF coaches called Referring a Client to Therapy, and it's a free PDF guide. And, they talk about a lot of key points to work through as well. And I know this might be a passion point, Lynn, because they talk about the main distinctions between coaching and psychotherapy are based on focus, purpose, and population, and how coaching focuses on visioning success, the present, and moving into the future, whereas therapy emphasizes psychopathology, emotions in the past, in order to understand the present.
And here we go again.
Yes. And so, about the whole creating new questions, and I loved what you said about not pigeonholing therapists either, because they do so much work more than just try to unravel the past.
Absolutely.
And so, are there any resources that you'd recommend for coaches in terms of trying to, get an answer to some of the questions we raised in this conversation?
I think your ICF PDF is a good starting point. Specific to that question, I don't know that I have like a manual or a resource. I think it's still in production, really. Um, but on a personal level, I think it's really important for coaches to trust their gut and to just really know what you don't know. That's what a mentor or advisor told me when I was first in the field of therapy is it's more than anything, you need to know what you don't know. And following up with that is to trust how your stomach, how your physical body feels. Like are you getting a pit in your stomach thinking, "Oh, I don't know how to help this person?" If that comes up for you, then that's a red flag to be like, "Oh, maybe I'm not the best person for this job, and maybe we can get someone else to collaborate," or because you can do coaching and therapy simultaneously if if it's agreed upon and if there's a delineation about what role each person is playing. But I think that's my best advice is to really trust yourself and to trust what you don't know.
I love that. And just to add on that, the takeaway I'm getting too is this lifelong learner. So as coaches, it's always so important to seek professional development. And since I created my coach agreement while I was still in coach training, I have a little thing in there because for confidentiality, we always have to disclose the scope of confidentiality. And so one of the things I asked for permission for is, can I share your information in an anonymous way, just remove your identifying information to seek my own professional development. So, as a coach seeking mentorship. So, I love what you said about trusting your gut and having that be a red flag. That's amazing. And then, just on top of that, is that we can also seek support for ourselves and phone a friend or get formal mentorship to really be able to help
Absolutely.
have a a way of navigating these situations because they will come up. It's just a matter of when.
Right. And there's a huge coaching community. So to be able to collaborate and ask for feedback or guidance is, we're not alone on an island or in a bubble trying to figure out life. We do this in collaboration with others.
In that collaborative spirit, thank you so much for sharing your wisdom. And it's just such a treat getting to learn from you today. So thank you so much for being here.
It's an honor to be here. Thank you so much for having me. I just want to say that everything that I've said is just based on my experience. I'm not the expert on this topic, but this is just how I've experienced and how I've understood the differences between coaching and counseling.
And it takes a lot of courage to have a conversation like that, to share your opinions and your wisdom and your perspective so openly. And so I really am grateful to you because these candid conversations, this gray, is where the learning happens and where the questions happen for future growth. And so I'm not representative of all physicians or medical advice or any of that stuff either. I'm just in this place to learn. And so it's wonderful, like you had talked about, there's a large coaching community that we are able to do these and have these conversations for each other because
Mhm.
this is how the field grows and how things change. And so I'm really grateful and want to thank you for your courage and your sharing.
Thank you so much. I really appreciate being here and having this conversation. It's an important one to have.
Yes, it is. Thank you. Thank you for listening. I appreciate you and value your feedback, so please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.